Hello, everyone. Welcome to TALRadio. This is me, Saankhya, and you are listening to TALRadio. First thing, health is something that we can gain over time with right kind of lifestyle, right food, and right workouts, of course. But most of the times, we miss out on right kind of information. A single piece of misinformation has the power to demolish everything that you have ever developed, right? And that's why TAL Radio always tries to provide you the most accurate information with professionals in the respective fields. While looking for a passionate health advocate, we came across this amazing person. And when I say she's the best, she is the best. So I am talking about Nalini Saligram, who is the founder and CEO of Arogya World, and who is very passionate about promoting global health and assembling like minded people to fight against the NCDs. And today, I'm privileged to be hosting her and hoping that this interview is going to be very engaging. Let me welcome Nalini Saligram on the show. Welcome, Nalini. How are you doing?
Good. Thank you. Thank you, Sankhya. Yeah, no, I'm
Okay.
excited to be part of this, especially as I learn your mission, learn more about your mission. It's a wonderful thing you all have started. So I'm very glad that we are part of it.
Yes. So it's already really great to hear about Arogya World, a non-profit organization. So can we know when was it established and what inspired you to start this organization?
Yeah. So I founded the organization on 8th of March, International Women's Day in 2010. I wanted very much to work with like-minded people and like-minded organizations and really make a meaningful contribution to global health. That is why, Arogya World was born. It was born to make the world a healthier place. As you know, Arogya means good health, and we want to change the course of chronic disease in every community, one community at a time. We started with India. We are still working in India 12 years later. And India is a complex and vast country, and we want very much to make a difference in the lives of people by improving their health and their health habits. And we believe we can do that outside the healthcare system. So we work in the community. I'll tell you more about our model as this session goes on. But that was
Yeah.
the purpose, was to make a global contribution to global health, and it's still what drives us today. Diabetes runs in my family. I grew up in Bangalore in India. I have a PhD in biochemistry from the Indian Institute of Science. And, I wanted very much to use my science background, my ability to work with people from all over the world, because I had the privilege of living and working in many continents, and my communications sort of experience. I have worked in public affairs. In my last real job where somebody paid me was at Merck
Mhm.
in public affairs. So I wanted to use all of that background to do something, a bit beyond being someone's wife and someone's mother. So I
Yeah.
really did want to use me, and we have made a lot of headway over the decade or so that we've been in existence. It's been exciting every single day. I feel it's my privilege to be working in at Arogya World with incredible colleagues and incredible partners.
That is wonderful to know. So, I have read about NCDs while I was trying to read something about you. So, as you mentioned that you're working towards or against NCDs, so can we know how big of an issue this is for global health?
Yeah, so it is probably the defining challenge of my generation and of our times, this decade, for example. The Millennium Development Goals were very ambitious, and the world made good strides against it. But if we don't conquer these non-communicable diseases, we will wipe out all the gains the world made against diabetes and NCDs, and it'll be really hard for us as a world to meet Sustainable Development Goals, particularly goal number 3, which is health for all.
Mhm.
So India is a very big part of that equation to meet SDGs. It's got 1 billion plus people, and India is a diabetes capital, and it's a non-communicable disease capital. In India, diabetes, for example, is 2/3 of the reason 2 out of 3 people die from non-communicable diseases in India, a country where the public health agenda is so crowded. You have maternal mortality still, you have under 5 childhood mortality, you have infectious disease, you have so many other problems, but yet more people are dying now from these non-communicable diseases like diabetes, heart disease, cancer, and chronic lung diseases. These are the 4 diseases, and now mental health is included by the WHO under NCDs, non-communicable. And so we work very much in India, across India, because we feel that, hey, India is a really big crucible for change. If we can make it happen in India, we can probably export our model to other countries as well, because we have so many different patterns of eating and socioeconomic levels. So we are working hard to make this a population level prevention approach.
Yeah. And looking at the India's population, it really looks like a lot of work right now.
Yeah.
So, yeah. So, are there any works that you have done or any achievements so far in your mission? Can we know about them?
Yeah. So our approach, let me back up and give you a few more stats on
Yeah,
diabetes
sure.
and its prevalence, because I think if you don't follow the problem, you won't
Yeah,
appreciate the solution.
sure.
The up to 3 out of 4 people in India are affected in cities are affected by diabetes or pre-diabetes. So they are either having the disease themselves right now, or they are at very high risk for getting it in the next few years.
Mm,
Imagine 3 out of 4 people in Chennai, in Hyderabad, in Bangalore are running around, are walking around, with either diabetes or pre-diabetes. It's a ticking time bomb, surely, in India.
yeah,
And then
yeah,
you have, 10% of India's children have pre-diabetes. 35%, a third of India's 10-year-olds have high BP. A third of adults have high BP. So this BP and diabetes and heart disease, these are really prevalent in Indian populations, and
yeah,
it is so widespread that treatment alone, a focus only on treatment, is really, really hard. You cannot, for example, distribute cholesterol medicine to everybody who needs it. It is just so hard to imagine
yeah,
how to do something like that. Yet these diseases are largely preventable. According to the World Health Organization and according to very big landmark studies, you can actually prevent 80% of diabetes, 80% of heart disease, and 40% of cancers with 3
wow,
lifestyle changes. You must eat
wow,
right, exercise, and avoid tobacco. So, this is our mantra: prevention of non communicable diseases, especially diabetes, through healthy living. That is at the core of all our work, because it is evidence based, it's science based. We don't have to repeat it. We just take that evidence and make healthy living possible in the community. So we work with the doorstep health model. That's our first achievement, that we believe we are making traction with our doorstep health approach, which means we are taking prevention to people where they live, learn, and work. Doctors and nurses and healthcare providers in hospitals and clinics are really stretched. They don't have time to give a lifestyle change advice. That lifestyle change prescription, groups like us can step in and give it. And we do. We give it in compelling ways to school children in schools. We reach working people in workplaces. We reach people on social media as well as on their phones. We have a text message and voice message based program. And our latest is called Arogya City, where we are
yeah,
transforming an entire city to become, especially Bangalore, to become a healthy city.
wow,
So we have made traction with this outside the doctor's office approach to prevention. And that doorstep health model, I believe, is our sort of sustainable and our legacy to the
Mm.
field of global health. The second is we've reached 9.3 million people cumulatively across the various programs in the last decade. And this year we are projected to get to 16 million. So we are aggressively scaling up now. And we
Mm.
have shown evidence with our programs. Our programs are proven, and therefore we are very excited about this next phase, which is very, very pivotal in our journey. We are scaling up big time because at the end of the day, we think we are in the impact making business. For
Yeah,
us,
of
it's
course.
not so much the reach, it's what did we do to improve people's health. And we believe we are changing their habits, their lifestyle behaviors. We are getting
Yeah,
them to set up to prevent diabetes. So those kinds of things really, inspire us to get to work
yeah.
on a daily basis.
Of course. And it was scary knowing about NCDs and their statistics in India. And it's also like very, like it has given a relief that people like you are working towards it, from bringing a good change. So that
Mhm.
I really appreciate that.
Mhm.
So I have another question. It's
Mhm.
been very long since you have established this organization. So what is the greatest challenge that you have to face in this journey?
Yeah. So one of the challenges in this space is, of course, funding. I mean, you must be hearing about funding from every nonprofit that you
Yes,
speak
yes.
to. But it is in this non-communicable disease space, it is actually really hard to get funding from donors, companies, or
Yep.
agencies, government agencies, these and multilateral agencies. These are all really difficult places to get funding from. The second, and one of the, even in this health space, the prevention aspect is even more difficult to fund. People can maybe invest in treatment in hospitals and providing care, but getting
Mhm.
people to become healthy before they get the disease is something very hard. Nobody wants to invest in it. So it's really hard, very difficult to get funding in this space. We need progressive individuals, progressive global thinkers who can mobilize funds for this. The second challenge we face is regulatory concerns in India, and mobilizing
Mhm.
government to focus on prevention, because the government of India is very focused on screening and treatment. But to get the
Yeah.
government bodies to focus on prevention and use prevention as a way of engaging with consumers in between screening visits. You screen them today and you screen them next year. In that 1 year, to keep them engaged on health, prevention messages like ours or programs like ours are a very good way, and you'll be improving people's health in the meanwhile. So that is a little tough. We're making our way there. And the third actually challenge would be to work with large NGOs and get people like in the education sector, for example, to take up health, and for health people with health NGOs to take up NCDs and prevention work, because the
Yeah.
infrastructure that someone else has set up is something that we can leverage now. If we all stick to our silos and our missions and our mandates, we will never achieve this sustainable development goal. I really
Yeah.
do believe we have to work in collaboration. It is truly the need of the hour. Education NGOs must do something more than education. Health NGOs must take up different aspects of health. And we all must
Yeah.
collaborate to make things happen. So there's a lot of challenges, but I think they're surmountable.
Yeah, of course. And I'm really hoping that all the TAL radio listeners who are listening to it would come forward for some donations, and we will also try to promote it as much as we can. So I'm really hoping for that. And yeah, so you've been through a lot of experiences while serving the society, right? So is there any particular incident or a success story that you would like to share?
Yeah, so we gather comments and feedback and testimonials from all our beneficiaries and our partners.
Mm.
And the experiences of the kids and the teachers in the schools where we take our programs is very, very inspiring. We know we have actually moved the needle with the children because they are absorbing at age 11. We're teaching them, for example, with games. So, a big snakes and ladders, they play a big, they put a big flex on the floor and they roll giant dice and they run up and down for the ladders
Mm,
and the snakes. And they fully get it at age 11 that, hey, an apple may be a ladder and a bag of chips is a snake. And that
yeah,
life lesson never, something they would never forget. And that kind of evidence we are getting from observation, from comments, and from teachers as well as principals and the school children, their parents. And we are, working very hard to not just the science based, not just the data, but also these
yeah,
kinds of stories and anecdotes. And we are also, we have made headway with M Diabetes, our text message program, with My Thali, our tool that we use to teach people what to eat and in what quantities at every meal. We have got feedback from top nutrition advisors. We've As we convert it into for adolescent girls. So I'm really energized by
yeah.
the comments and feedback and testimonials that we are gathering from CEOs at our healthy workplace conferences, to this Arogya City thing has been really energizing because we have got 21 pledge makers in Bangalore to step
Mm,
forward and commit to working together and helping more than 500,000 people improve their health on a
yeah,
voluntary basis. This is all on a voluntary basis, and so it's really quite nice and exciting to see us move the needle by
yeah.
basically persuading and influencing others.
Yeah, that is exciting. And imagine getting so many good feedback from children, the parents, and all of them. It must be overwhelming to you, right?
No, it is exciting,
Like,
and
it's
I have individual stories, but we'll share those with you maybe with some links.
yeah, of course, sure,
Yeah.
sure. So, I was gonna ask you what keeps you motivated to resolve these challenges, but looks like you already have a lot of, feedback coming in and all the exciting work you're doing. They may be already being motivating you, right? Like they
No,
keep you
they are.
excited.
They keep me going, of course, that we know that
Mhm.
we are making a difference on the ground. So that is very positive. But more
Yeah.
than anything, it's the purpose. We know where we are going and we are all steering the boat in the same direction. So we know, for example, that we are here to make a difference in the trajectory of diabetes in India. And that till what we are doing is a bit drop in the bucket. To be honest, we have
Yeah.
so much more to do to
Mhm.
actually claim that we have done something to shift that trajectory. So we are working very hard towards that. It's the purpose more than the feedback. It's
Mhm.
the purpose that keeps us all grounded and excited.
Keeps you going. Yeah. That's amazing. So, Arogya World is going to be a part of India Giving Day, right? So, could you share something about this event?
Yeah, so we are founder members. Arogya World is a founder member of the India Philanthropy Alliance, and this India Giving Day, which is starting on Tuesday, the 14th of Feb, and is the actual day is 2nd of March, but early giving starts 2 weeks earlier. So we
Mm,
are really excited about being participants in that. It is wonderful to watch the IPA take up a major issue of mobilizing people in this country, in the US, to give to India and to give to India causes. And it is time for this very successful group to step up and own its responsibility and really make a difference on the global stage. So this is a wonderful opportunity, and it's exciting to see how much energy and momentum and people like you are joining to help charge people up. So this is great. We are very, very positive about the outcomes from India Giving Day. It's the very first time all of us are doing this, something like this, collaborating to raise funds together. So it's very exciting to see that happening. I wish the team working on this really well. I hope this is a big success. But I
Yeah.
also, I'm excited as an Indian American that there are outlets like this to positively contribute to India's future.
Yeah, even we wish that this event will be a very huge success. And yeah, my next question is, you are a member of India Philanthropy Alliance, IPA, right? So can you share more about the thought behind this alliance and how it is helping in your journey?
Yeah. So we've been founder members. So it's, I think, been 5 years or more when it was started. It was started at India's Spora Forum
Mhm.
with a view of doubling or tripling the amount of money given to India, and then can we do something about it? That was the spirit. And yes, a lot of thought has been given to it. Alex Counts has been leading that effort, and we now are 14 organizations, I think, and many more are going to be joining us soon. The
Yeah.
group meets, actually, the leaders of all these different NGOs meet once a month, and we've been at it for 5 years now, once a month, connecting to discuss sort of issues and future and programming. But we
Mhm.
also collaborate with each other. And for me, we are the probably one of the smaller organizations that are members of the IPA. And for me, it has been a learning and an absorbing of watching the approaches of all these bigger organizations, learning from them, their strategies and approaches. And that is helping, just absorbing how people are tackling philanthropy and fundraising itself. It has been a very good learning. And we are getting a lot of everyday insights that are helping our organization also progress. So it's been a very positive uh, chapter in our lives.
Okay, wonderful. And we have come to the end of the interview, and the interview has been really inspiring and educative. And I'm really glad, to be finding people out there like you who motivate more people into participating in such health activities. And it is also making us feel like we're not in a very threatening world, like where everything regarding our health sounds like a threat. People like you are really making a huge difference, makes us feel like someone is there to look after the health. So it's been wonderful,
Oh,
Mrs.
thank you.
Nalini,
Thank
and thank you once again for being on Tal
No,
Radio.
thank you. Thank you for your time. What is the problem may be so huge and may look so daunting, but every
Mm,
individual can contribute by taking up health for their own lives. And it's
yeah,
important for the physical health, it's important for your mental health, it's also
yeah,
important for yourself as a working, as a part of the workforce. Because if
yeah,
you don't take care of health, you're not going to be a productive employee, and therefore the country will
exactly,
suffer. So there are so many related issues.
exactly.
It comes down to, hey, I am accountable for myself, my family, my community, my country.
Yeah,
We really have to take it up, because there is a link. You
yeah,
can see a line, a pattern, that, hey, if I take care of my health, perhaps my country will progress, and perhaps the world will progress
exactly.
toward
It's all
SDG.
it's all interlinked, Everything is interlinked. Yeah. That is amazing. And I once again thank you. And I really feel privileged to be hosting you today. It's been a wonderful interview.
Thank you for your time, and thank you for the wonderful work TALRadio does.
Thank you. So that's Nalini Saligram, and it's been an amazing interview. And for more such informative talks, insightful shows, and acts of kindness, stay tuned to Tal Radio, powered by Touch a Life Foundation. Until then, stay tuned, and this is me, Saankhya, signing off.